Good morning to everyone! Welcome to Sunday's morning show, Doctors on TV. I'm your host, Dr. Sara Barbacabodil. Isang makabuluhang umaga ang aming handog sa inyo because health is wealth. At para sa dagdag kaalaman, alam niyo ba mga kasambahay na kada araw nasa 800 women ang nasasawi dahil sa pagbubuntis at childbirth o panganganak. Kaya naman po tuwing second week of May ay pinagdiriwang ang Safe Motherhood Week. Ayon sa World Health Organization, ang Safe Motherhood Week ay itinalaga sa Pilipinas upang magbigay kamalayan ukol sa kalusugan at tamang nutrisyon para po sa mga kababaihang nagbubuntis. And moving forward mga kasambahay, naku, alam ko pong kaabang-abang ang topic natin ngayong araw. At bago po natin umpisahan, akin muna pong ipakikilala sa inyo ang doktor na ating makakapanayam. We are honored to have a distinguished guest with us, a highly accomplished orthopedic spine surgeon who specializes in the treatment of sciatica. Let us welcome Dr. Buenaventura Canto, also known as Doc Bruce, an orthopedic spine surgeon from Makati Medical Center. Good morning, Doc Bruce, and welcome to Doctors on TV.
Good morning, Dr. Sara, and good morning to the viewers.
Yes, Doc, thank you at pinaunlakan niyo aming paanyaya. Po, napakarami nating matutulungan. It's very common din ng sciatica, Doc.
Yes,
diba?
that's right.
Naku, iisa-isahin po natin, Doc, para maintindihan ng ating mga viewers. Okay, so umpisahan natin. Pag sinabing sciatica, ano nga po ba ito?
When you refer to sciatica kasi is actually a symptom, no? Hindi talaga siya sakit. So when you say sciatica, it actually refers to nerve pain, no? Ito yung pain na nanggagaling sa nerve sa likod kapag naiipit siya, either by yung tinatawag nating slip disc or minsan may butong tumutubo. So pag yung ugat sa likod na naiipit, tatakbo yun pababa, no? It can radiate down sa buttocks, sa thigh, or minsan hanggang paa pa rin, no? So yun yung actually sciatica. So it's actually a sign of something else that's happening, no? Symptom talaga.
So hindi talaga siya yung sakit?
Hindi siya
so
talaga yung sakit.
So basically, siya yung manifestation na may problema dun sa site.
That's right.
And speaking of site, Doc, you mentioned about likod. Okay, so we know na merong upper back, may lower back.
Yes.
Okay, so saan banda po ito?
So when you say sciatica, it actually refers to the lower back, the lumbar region. Kasi,
lumbar region, dito sa may puwitan ba yan,
dito
Doc?
sa lower back. So sa model, parang dito. Kasi sciatica is referring to the sciatic nerve, no? The sciatic nerve is actually made up of the nerves coming from the lumbar region. So specifically L4, L5,
Saan banda yan
S1,
dito
S2.
para sa kaalaman ng ating mga viewers, Doc?
So ito yung model ng spine, yung pinakamalapit na sa balakang, no? So itong mga nerves na ito.
Pwede natin, Doc, iikot kasi kung ito yung likod, no? Para mas makita natin. Yeah.
So,
ito yung pinakapuwitan, Doc, no?
Ito yung
diba?
balakang natin.
Balakang.
So kita nyo naman, may mga ugat lumalabas, papuntang kanan, papuntang kaliwa. So ito mga nerves na to sa bandang dulo na, nagbubuo sila dito sa likod to form the sciatic nerve. So kung may pag-iipit dyan anywhere, yun yung manifestation, yung tinatawag nating sciatica.
I see. Pero ang pain basically, pwedeng pababa, kakalat.
Yes, that's right.
Okay. So not focus dito po sa mismong pinaka...
Hindi. Yun yung ano doon. It's yung pag-iipit nandito, pero yung pain natin will be felt usually sa puwet, sisimula sa buttocks, and then pababa. Yan. Ganyan.
I see. Okay. And ito po ba may iba-ibang uri din?
It's actually, hindi naman sa iba-ibang uri. It's more of, it's classified as either acute, chronic, or subacute, or in resolution phase already, kung tinatawag na yung pagaling na sciatica.
Pwede po nating himayin kung ano yung mga na-mention nyo kanina.
Okay, so acute, when you say acute, syempre newly onset, yun yung mga bagong nararamdaman lang, that usually occurs within the first week or first 2 weeks or so. Madalas, karamihan, after 4 to 6 weeks, nagre-resolve sa mag-isa, no? But when it persists after 6 weeks or so, yan tinatawag na chronic na yung ganong kaso.
I see. Okay, so may kinalaman ba yan kung ano yung sanhi or cause nung
Definitely,
sciatica?
yes. So it depends on what is causing the nerve compression. Yun talaga yung will determine whether it will resolve on its own or whether magko-continue pa rin or will persist. That's right.
I see. And ano po yung mga risk factors? Bakit yung ibang tao nagkakaroon ng ganitong manifestation, yung iba wala?
So I can explain it very well. I'm going to use this model.
Yeah, please,
no?
Doc.
So sige. So again, no, I mentioned earlier kanina, this is the spine. And then yung spine natin, no, kita nyo naman buto na patong-patong. Tapos in between each bone, yung tinatawag na disc. So yung disc, siyempre hindi siya kasing tibay ng buto, malambot siya. It allows us to move our spine, no? Kung walang disc, para tayong isang mahabang buto lang. So yung disc, siyempre, since hindi kasing tibay ng buto, after a while, kapag sobrang gamit, natutuyo siya, nalalaspag siya. Ang problem with the disc is, hindi siya nagre-regenerate, hindi siya nag-heal, no? So, Itong dilaw na to, sa model na yan, from the brain, ito yung brain stem, yan yung tinatawag na spinal cord that actually stops at this level. Tapos pababa, nagiging mga nerves na lang siya, no? Napapuntang, itong mga nerves na yan sa model, papuntang babang kanan, yung like I said kanina, sa may buttocks, thigh, and then knee and leg, and then dito rin sa kaliwa. So in other words, yung wiring natin o yung electrical natin, no?
Mukha nga siyang ano, no?
Para
Electrical
siyang,
wires.
wires natin na nagsisilbing gumagalaw at yung pakiramdam sa paa, dito nang gagali. And if you can see yung spine natin, pagharap mo yung tao, dapat diretso, hindi ba? Pero pag sa side view, ito yung natural na posture dapat natin ng tao. May kurba talaga dito sa lieg, kurba upper back, and then even in the lower back, may arch yan. Yan yung tamang posture. Ang problema natin talaga, which I always tell my patients, is that kapag matagal tayo nakaupo, no? Hindi natin kayang i-maintain yung posture natin na may arch na ganito.
Nakakangalay din kasi, Doc.
That's right. So what happens is, ang upo natin, gumaganito tayo. Ang hilig natin mag-slouch, no? Ang hilig natin mag-crouch forward. Ayan na yung mga tao sa, no? Nagdediretso na sila ng upo. So, when that happens, kapag gusto nating lagi tayong naka-slouch, siyempre, cellphone, laptop,
mas comfortable kasi, di ba?
That's right.
Parang okay, relax ka lang, rather than parang you have to keep to maintain your posture.
But you have to remember, yung muscle natin na ganyan kahabang tensyon, yan yung relaxed position. Kapag dinidiretso mo ito, o kaya yumuyuko tayo, ang sarap ng feeling na stretch, hindi ba? Pero hindi tayo bumabalik sa resting position. So kung halimbawa, 8 hours ka nakaupo sa opisina, sa bangko, kaya chef ka, nagluluto ka, yung muscle mo hindi na re-recover. So day in, day out, 5 days a week, ganyan yung ginagawa nyo. Ang tanging pahinga nyo lang ipaghihiga, tapos mali pa yung posisyon sa paghiga. May niyakap pa kayong maigpit, unan, or whatever. Diretso na naman yan, di ba? So what happens is, yung muscles natin, mahinang-mahina na. So, hindi na niya nagagawa yung trabaho na support yung bigat ng katawan. So, what happens? Yung bigat ng katawan ngayon, nakasalalay ngayon sa buto. At kung araw-araw yan, every day as years go by, yung discs natin, na yan yung mas lalong naiipit, nalalaspak siya. Nagtutuyo, nagiging marupok, and when that happens, nagkakaroon ng mga crack, tapos tuloy pa rin ang pressure, balang araw magkakaroon ng mga butas yan, or cracks. And then, tuloy pa din ang pag-iipit, lalabas yung laman ng disc. Ang problema, yung ugat o yung wiring na binanggit natin kanina, nandun mismo sa likod. So pag lalabas yung laman, ang unang niyang tatamaan yung ugat. So yan yung tinatawag nating slip disc or disc herniation, which causes nerve compression. Kaya tuloy yung marami ng pasyente, masakit. Tumatakbong pain. It's a neuropathic tingling sensation, minsan burning sensation, minsan nasa ditong lugar lang, sa buttocks lang, minsan even more chronic cases, umabot sa foot.
Ay, hanggang paa.
Hanggang paa. So pwedeng disc ang umipit, or sometimes for older patients, yung buto dito sa likod ng ugat. Sometimes kapag sobrang gamit din, older patients nagkakaroon ng arthritis or rheuma, or what we call spondylosis sa buto, here. Pag kumapal naman yan, ipit din ng ugat. So, there are many things that can cause nerve compression that can actually manifest as sciatica. So again, sciatica is the symptom, pero iba pa rin, we don't know what, marami pa ang possible causes that can give rise to that problem.
Yeah, I'm just curious, may minention kayong another condition, di ba, yung spondylosis. How about yung lumbar desiccation na naririnig natin?
Pag sinabing desiccation, that's actually a radiographic term, no, nakikita sa MRI. Pag sinabing desiccation, nakikita dun sa MRI na parang nangingitim yung disc. Kasi in normal MRI, dapat yung mga disc natin bright or puti, no? Kasi pag MRI natin, tubig, fluid, or sometimes fat, maliwanag, no? So para maging elastic ang disc, maganda may good water content. Pero kapag sobrang naiipit, as it degenerates, nagiging desiccated, nagiging dehydrated, natutuyo. So you see that on MRI as very, very dark. So yun yung disc desiccation.
So that's a different thing naman dito sa ating pinag-uusapan.
It's more of I think, a radiographic term talaga.
I see. Okay, and ito po usually, yung mga pasyente na nakakaramdam ng pain, so you mentioned kanina, it depends po dun sa cause or sa sanhi, no?
Yes, that's
para
right.
malaman yung time duration ng manifestation, ng sciatica
That's
per se,
right.
okay? And, pero ito ba, can this lead to paralysis? Kasi we're talking about nerves here, di ba?
Yeah, oo.
Pwede po bang maparalisa ang isang taong for long meron ng sciatica?
Actually, again, no, it depends on the cause of the sciatica. So if it's just a disc bulge or a disc herniation, and also depends on the length of time that the patient has been experiencing the sciatica. It's a very, very low percentage of patients who have what we say paralysis. Although yun nga, pag medyo matagal na, halimbawa tinitiis nyo yung sakit, hindi nyo dinadaing, hindi nyo dinadala sa doktor, yung nerve natin, dahil ipit na ipit, syempre, konting-konting namamatay yung mga cells. Hindi makadalo yung dugo dun sa nerve para sa kanyang nutrition. So the patient, usually longer cases, hindi lang pain, nagsisimula ng magmanhid yung paa. Hindi na siya nakakaramdam, mas nangangapal yung kabila.
So pag nagmamanhid na ba, parang it's not a good sign?
Not a good sign also. Even more so, kapag longer pa, minsan humihina, nagkakaroon ng motor weakness, no? May mga pasyente, iba nagkakaroon ng foot drop, hindi na nila maangat yung paa dahil nakabagsak na. So sometimes, pag ganon, alam na natin na chronic talaga yung case, matagal nang naiipit yung ugat, so therefore, mas kailangan urgent yung treatment natin.
I see. Okay, so dito, nakikita natin na talagang multifactorial po ang sciatica.
Right,
And another thing, so napakahalaga din po yung pag-maintain ng magandang posture.
That's right.
Okay.
Yun yung simula pa lang, yun talaga yung dapat.
Naku,
posture pa lang.
Pero Doc, alam ko, it's better said than done. Ako like, I'm guilty of that.
Very,
Okay,
very
pero
difficult.
how about sa pagtulog? Ano ba dapat yung proper positioning?
In general, sleeping, there's no real fixed position. Kung anong mas komportable sa'yo talaga, that's okay, no? Basta as long as you wake up na walang pain. But for patients with sciatica, sometimes it's advisable na mas maganda yung tutulugan mo yung sa side na walang pain. That's one. Or kung gusto mong flat matulog, mas maganda yung may unan sa ilalim ng knees. Kasi pag nakabend yung knees habang nakahiga, nawawala yung tension dito, no? Hindi siya nahihila. So it's relaxed, so nawawala yung pain usually.
Okay. And you mentioned that na nawawala yung pain. Okay, so dun sa mga naka-experience na ng sciatica, which is more comfortable sa kanila, I mean, which would be more, how do I say that, helpful para sa may mga sciatica, yung bang mag-rest na lang muna or dapat stay active talaga, which is better?
Yung initial treatment namin for sciatica is initially we have to find out first talaga what is the cause, no? Let's say yung most common cause talaga is a disc herniation or a slip disc. The initial treatment for that is really physical therapy. What we want to do is we want to strengthen yung abs natin, no, which is in front, and then yung muscles sa likod para yung bigat ng katawan hindi nakasalalay sa buto. Remember, it starts out pagod na pagod yung likod nyo, hindi nabubuhat. So once you strengthen that, hopefully, yung bigat, sinasalo na ng muscle, ma-offload ito. Hindi na siya mapipisa masyado. So, physical therapy is very, very important in the treatment. It is successful usually about 85 to 90% of the time of treating these kinds of problems.
Di ba, Doc, dadako tayo, mahihimayin natin yung mga iba't iba pong approach sa management ng mga individuals na may sciatica. Okay, pero Doc, basically, so parang does it suffice to say na just like most of the medical conditions, so mas maganda po directed towards sa etiology or sa cause pa rin ang approach natin sa management.
That's right.
Okay,
that's right.
and yun yung pag-uusapan natin maya-maya po lamang, di ba, Doc? Okay, and dito ba sa sciatica, apart from dun sa spine problem itself, meron pong mga ibang medical conditions which can actually, give rise to having a manifestation of sciatica?
Usually nga, it involves around the nerve compression around the spine. So, yun nga, the structures around the nerve are the ones that are involved. Sometimes, bawa, yung pasyente darating, normal ang MRI, maganda yung MRI niya. Pero yung symptom niya, sciatica pa din ang dating, no? Talagang, Doc, tumatakbo pa rin pababa. There is another possible reason. Dito naman sa may bandang palakang natin, sa may bandang muscles natin sa buttocks, mayroon tayong isang notorious muscle dyan, it's called the piriformis muscle. Related na naman yan sa sobrang upo, no? Pag laging nakaupo yung pasyente, laging, alam nyo yon, yung matagal na palipat-lipat na ng pisngi ng upuan natin, yung muscle na yon nai-irritate. And that muscle wraps around the sciatic nerve before it goes down to the thigh.
Parang yung namamaga yung muscle.
So yung muscle kung namamaga or nagko-contract parate, naiipit din yung ugat, pero hindi sa spine level, dito na sa bandang buttocks area.
I see.
So normal nga yung spine mo, maganda nga yung MRI, okay yung disc lahat, Pero kung yung piriformis muscle mo naman, nagko-contract parati o nagsaspasm, it will manifest as the same kind of pain.
Anyways, kung ano yung nakapalibot na, na tissue.
Yes.
How about obesity sa mga medyo nasa bigger side po?
Okay, so indirectly, pwede rin yun. Kasi when you treat patients like that, kasama yung weight reduction. Pag mas mabigat ang katawan, mas mabigat ang dinadala ng spine.
Yes, okay.
Diba? So, indirectly, kung mas magaan ka, less ang load sa disc, less ang pressure sa disc.
Para sa pagbubuhat, Doc, no?
Parang ganun din. Again, also works the same. But part ng treatment is you have to advise the patient, bawas-bawasan ng lifting, no? Pagbubuhat ng gamit. Bawa, kung trabaho nyo ay taga-buhat talaga ng taga-lipat.
Semento, ganyan,
Or something like mga
yeah.
caregiver, for example, no?
Yeah.
Sa nursing homes, no? Nagbubuhat ng pasyente, ganon. So, they are the ones who are prone to actually develop these kinds of problems.
Okay, so you mentioned about it. Sino yung mga individuals po? So like yung mga caregivers, yung mga nagkakargador,
yeah,
ganyan.
kargador, ganyan. Yan, yung mga technical na nagbubuhat lagi ng mga gamit, mga instrumentation. Actually, they call sitting the new smoking. Kasi naging apparent nga na through the pandemic, di ba, lahat tayo online, lahat tayo nakaupo sa screen, no? And then work from home environment. People who sit more than 4 to 6 hours a day have a high risk of developing this kind of problem as well. So, careers wherein you're sitting, banker, ganyan. Yung mga nasa BPO, yung mga nasa call centers. These are the patients I see every day, no? Na laging meron silang, either they start with back pain or they develop into sciatica. Yan, mga architects, IT, yeah. These are the patients I see almost every day.
I see. Naku, Doc, ang daming information. This is really an information overload, no? And naku, ito mga kasambay, dyan lamang kayo. Naku, marami pa tayong marinig mula kay Doc. Kaya magbabalik pa rin po ang Doctors on TV. Welcome back, mga kasangbahay! Before we continue our discussion, we'd like to invite you to follow and subscribe to our social media accounts. Please like and follow our Facebook page at www.facebook.com/doctorsontv. And like and subscribe to our YouTube channel. Just type www.youtube.com/UNTV News and Rescue. Maaari nyo rin pong balik-balikan, mga kasambahay, ang mga episodes po ng Doctors on TV sa aming Facebook page at YouTube channel. Kaya after liking and subscribing, i-share nyo na din po sa inyong mga friends and family dahil napakahalaga po ng pagkakaroon ng awareness tungkol sa kalusugan. At para pa rin po sa pagpapatuloy ng ating talakayan, still here with us is Dr. Buenaventura Canto, also known as Doc Bruce, an orthopedic spine surgeon from Makati Medical Center. Ayan, Doc, no? Okay. So ito po, para mas maintindihan ng ating mga viewers, no, yung lubos na kalagayan po ng ating pasyente na may sciatica. Panoorin po muna natin ito, Doc. Ang ating pasyente again na lumapit sa ating programa upang mapakonsulta po ang kanyang kalagayan. Narito po ang kanyang kwento.
Ano yung problem? Masakit yung likod?
Opo, tapos hanggang binti po siya.
Kailan nag-start?
December po.
Ano ba yung work mo?
Ano po technical director po. Tapos meron pong mga lifting po kami na ginagawa para doon sa mga...
Most of the day, nakaupo ka lang ba? Or
Most of the day po. Most of the day nakaupo.
Yes.
Yes.
And then yung pain right side.
Opo.
So start saan?
Dito po sa lower back po.
And then,
Dito po siya nag-start.
Going
Tapos,
buttocks,
opo, pababa. Hanggang dito po siya.
And then yung x-ray, kailan pinagawa?
December din po.
December. Okay, sige. Papahigain na kita.
Okay po.
Examine muna tayo.
Okay po. Sige po.
Again, yung pain, right? Buttocks,
Apo.
back,
Ito po.
buttocks going down the thigh.
Opo.
Kaya mo i-lift itong ba?
Opo.
Okay. Tama? Slowly. Yung isa, kaya mo i-lift slowly. Okay. And
Ganyan lang po siya.
Ganyan lang? Kaya i-lift all the way up.
Masakit po sa likod.
Sige. Relax lang. Bagsak mo lang sa kamay ko. Bagsak lang. Tinataas ko slowly. Masakit na?
Sa likod po. Masakit.
Sa likod? Here sa thigh, masakit.
Hindi po. Dito lang po talaga sa likod.
Hanggang dyan?
Opo.
Painful na. Diyan, slow. Sa left, pag ingat ko,
Wala naman po.
na.
Wala po.
But sa right, when I bend the knee and I do this, okay na.
Okay lang po siya.
You do this,
Wala pa po.
Sir Florence.
left, definitely.
Wala pa.
Okay.
Sir Florence.
Kaya mo lift against my hand? This one?
Lift.
Okay. Kabila? Okay, good. Sige. At akit ka bang konti? Okay. Sige. Flat. Sige. Push against my hand. Kabila? Okay. Walang manhid dito?
Wala naman po.
Walang pakiramdam?
Wala naman po. Pares okay lang po.
Equal?
Apo.
Equal?
Apo.
Equal.
Apo.
Okay, sige. Okay? Kapag ang spine nakita mong from the side, di ba, from the front view, diretso dapat. From the side, ito yung dapat tamang posture natin. Dapat meron tayong curve sa cervical, curve sa thoracic, curve sa lumbar. Ito yung tamang posture kapag naupo, nakatayo, or kahit nakahiga. Problem is, that's why I always ask the patient ano yung trabaho. Kung laging lifting or laging nakaupo, lahat tayo, no, after sitting for an hour or so, yung upo natin nagiging ganito. Diba? Hindi naman natin kayang upo ng ganito eh. Tuloy-tuloy, yung ideal posture. Kaya lahat ng upuan may bilog dito sa likod para ma-maintain that. So if we sit this way all the time, unang-una, yung muscles na resting na ganito kahaba, yan yung resting state ng muscle. Kapag lagi mong ginaganon, ano nangyayari sa muscle? Nababanat parate. So, the tension doesn't go away. Feel mo yun eh. Pero day in, day out, 5 days a week, 6 days a week, yung upo mo, 8 to 10 hours a day, for example, hindi nakaka-recover yung muscle. What happens is, yung muscle nagiging mahina, naging masakit. That's why you have chronic back pain. Okay? And then, as the muscles get weaker, hindi na susupport yung spine, ano nangyayari sa discs? Kasi siya yung naiipit eh. Tingnan mo. Yung discs na nalaspag. Pag nalaspag yan, constant repetitive pressure, naiipit parate, magkakaroon ng mga crack, parang exterior sa gulong ng bike. Diba may mga crack yan? Through those cracks, continue pa rin ang pressure, lalabas yung laman. Doesn't go out in the front, kasi nga ganito yung posisyon, kasi lalabas, palikod. And right behind the disc is your...
Yung sciatic.
Di ba?
Oh.
Ayun, no? Pag lumabas yung disc, tatamaan sa ugat. So, kaya meron kang ganyang pain. Right? Kaya tinan mo, pag hiniga kita, tapos tinaas ko yung paa mo, anong ginagawa ko? Sinistretch ko to. Di ba? Pag tumaas yung paa, stretch siya. Dapat walang pain kung maluwag yan. Pero kung may umiipit dito ganito, pag tinaas ko yung paa mo, hindi nakakagalaw, oh. Hindi nakaka-stretch, hindi siya nakakalaro in and out. That's called the SLR, straight leg raise test. So, merong nerve talagang naiipit dun sa spine, sa right. So, first and foremost, we have to confirm, hindi naman lahat ng collapsed disc may disc bulge or disc herniation eh. Minsan collapse lang, hindi siya naiipit. So, the confirmatory test is to do an MRI talaga. That's why I asked niya kung pwede i-MRI ka in advance kasi dun din tayo babagsak. This is what an MRI looks like. This is an example of an MRI with a patient with same location as your collapse and what it looks like.
Tapos yung mga bawal na pong gawin sa work.
Iwasan mo yung matagal na upo. Iwasan mo yung bawal ka na magbuhat-buhat. Diba kanina you're telling me buhat-buhat yung pagiging technical director mo. So, iwasan. Ang good advice is nothing more than 20 pounds. So, si male patient, 32-year-old male, I saw him and came in. Ang complaint niya, yun, ganun na ganun, no? Yung pain niya nagsisimula sa likod, pababa ng buttocks, pababa ng thigh, knee, leg, nasa right side niya. So, ang complaint niya, nag-start siya ng 4 months already, no? Na araw-araw, mas malala paggabi, hindi siya makatulog sa gabi, hindi siya makahanap ng tamang posisyon. In-x-ray namin siya, ang nakita dun sa x-ray ng spine, nakita yung space dito sa dalawang to, di ba dapat pantay-pantay yung height ng discs?
Yes, Doc.
Yung height ng disc dito sa dalawang levels na to, collapse na, bagsak na sa x-ray niya. So, without the MRI yet, we requested for an MRI. Most likely nga, baka nga, dun nangyayari, dun yung disc na nagkakaproblema. Kasi kung collapse yung disc on X-ray, most likely baka nagbabulge siya, baka umiipit na rin siya sa ugat, which is causing the symptoms.
I see. But in his case, nak-identify ba natin, Doc, kung ano yung risk factor sa case itong male patient natin?
Number 1, sabi ng pasyente, hindi siya nag-exercise. Medyo yung lifestyle niya, paupo-upo lang sa bahay, pamasyal-masyal lang. Wala siyang athletic activity, in other words. Mahilig siya sa computer. So, most of the day, nakaupo lang din siya sa harap ng screen.
I see.
Sa gabi naman, nanonood lang daw ng TV. So, ang mga tanong ko sa kanya is, ano yung posisyon niya pag
Kala ko kung ano
nanonood?
yung pinapanood niya sa TV.
Parang yung posture niya habang nanonood, naka-slouch din. So, it's really about lifestyle kasi. So, when you see these kinds of patients, you always have to already immediately encourage them na parang, alam nyo, lifestyle change talaga. You have to start right away. When I say lifestyle change, ibig sabihin, it's sit less and move more. Ang recommended amount of sitting actually by the International Spine Societies, they've all agreed, no? Dapat 45 minutes lang of sitting, tapos tatayo ka na, magsa-stretching ka for 5-10 minutes, and then whatever you're doing, you go back to work for another 45 minutes.
That's
again.
the most.
So that's the most. So yun yung dapat. And then you have to have at least mga 30 minutes of exercise a day. Either it be brisk walking or you have to also focus on yung core strengthening exercises. Kumbaga, yung sinasabing mga yoga, pilates, ganyan. Or yung mga Zumba for elder patients, ganon. Parang focusing on core strength talaga per se.
Okay, so basically lifestyle changes and then parang ito kailangan din pong matuloy yung mga diagnostic
That's right.
procedure which
That's
is like
right.
for MRI po
But I
siya.
mentioned to him nga, regardless of what we see, no, kung positive nga na MRI, meron siyang disc na nag-herniate, may slip disc siya, or whatever we see, ang initial treatment talaga dyan is therapy, no? Physical therapy. It has to be regular, no? Kasi karamihan sabihin, Doc, physical therapy, I do that naman once a week.
Yeah.
Kulang na kulang yung once a week.
How about weight management, Doc, in his case?
Weight management, sinabihan ko din siya. Actually, sabi niya, syempre, of course, kailangan magbawas din ng timbang, no? Kasi kasama yun sa treatment. So, that's also important fact.
Okay, and pero Doc, yung gantong klase ng case ito no, sa male patient natin, I mean, comparing to dun sa mga cases po na encounter nyo na sa inyong practice, usually po with proper lifestyle change and yun nga po, nag-physical therapy, no?
Yes.
Kalimitan po ang improvement will be remarkable after what duration of time?
Usually, I give them about 12 sessions, which is about a month of therapy. So, if the therapy is done ideally 3 times a week, that's 12 sessions in a month. And if they have significant improvement, that's great, no? Ang sasabihin ko na lang is continue that kind of lifestyle, continue the exercises, and then, of course, yung sa opisina or sa workplace, dapat ganun na bawasan yung upo. But if they don't respond, let's say for the first 2 weeks pa lang, Doc, walang pagbabago, and then you see on the MRI, significant, no? Yung malaki yung disc na lumalabas na umipit sa ugat, then I already offer other treatment options, which is usually surgery. Ang maganda ngayon kasi, usually we always prescribe therapy, no? But for some patients na, siyempre, masakit na sakit. Doc, paano ako magta-therapy na sobrang ang pain?
Yeah.
When therapy involves exercising as well,
Yes.
no? The good thing now is in Makati Med, we have what we call the spine endoscopy, endoscopic disc removal, no? Or percutaneous endoscopic discectomy. So, ang nangyayari is, imbis na yung traditional na malaki yung hiwa,
Sa
diba,
likod.
pag surgery, ganyan kalaki yung hiwa,
Yeah.
tatlanggalin yung buto para maabot lang yung disc na lumabas. Ang gagawin ngayon, maliit na hiwa lang, kasing liit lang ng isang ball pen, mga less than 1 cm. May camera yon, may light source. We go in through this normal occurring exit hole.
Yeah.
It reaches the disc, we clean it out, remove the disc, tapos na. So in about 30-40 minutes or so, wala nang pain yung pasyente, yun talagang dramatic yung recovery, and then they go home either the same day or the next day.
I see.
So, for those patients who are in severe pain na hindi rin kaya tolerate yung PT, or hambawa, kasi pag piniti mo, mag-i-improve ka after 12 after 4 weeks, pero balik na naman sa dating gawi, no? Ang hirap-hirap i-break yung habit na ang sarap umupo na matagal, ang sarap yung posture natin.
So, plus of course, the need na gawin mo yung trabaho mo na
Yung
nakaupo.
disc kasi na ganyan, hindi natutunaw. It stays there. So, one wrong, sometimes magkamali ka ng buhat, laging naipit yan yung ugat, balikpiti na naman. So, for those patients who don't want to go through that, we already offer that option na. Off the bat, kung gusto nyo hong tanggalin na namin yung portion ng disc na umipit sa ugat, we can do that. And then yung recovery, after 1 week you can go back to work already.
I see. Teka, Doc, you mentioned about that advanced technique,
Yes,
okay,
yes.
with the use of the
Endoscopic, that's right.
endoscopic siya, no? So, ganong katagal yung procedure itself?
The procedure will take roughly between 30 to 40 minutes.
Oh, not that long naman.
Yes, that's
As compared to the traditional, which would last for about...
Depends on the surgeon. But on the average, similar, mga ganun, an hour also. An hour and a half din. But the recovery is longer for the traditional.
kasi mas malaki yung...
Kasi yung sugat ho natin sa open surgery or yung tinatawag ng microsurgery, malaki din, no? And for a wound to heal like that, usually mga 2 linggo pa. And then, yung pasyente will also still complain of back pain kasi nga may inoperan siya, may sugat siya. So, mas matagal yung return to work, no? Yung time for return to work. But with this one, kitang-kita, the patient gusto nang umuwi the next day, parang walang nangyari. So, it's a very ideal treatment nowadays for specifically disc, slip disc problems.
Especially for those who need to go back to their usual, yung kanilang work, no?
That's
Kailangan
right,
na sila
that's
makabalik.
right.
Dapat yung downtime or yung recovery period would be more ideal kapag ka mas maikli siya.
That's right, yes.
Okay. And kanina, Doc, di ba, sinabi niyo prior to, recommending surgical intervention,
Yes.
di ba, tinatry muna na kung baka magre-respond sa physical therapy. How about yung yung mga, iba kasi di ba nagpapamassage, common kasi yan na parang, sakit ng likod ko, pagod ako the past
That's
week,
right.
and ganyan. So, naku, it's been a month, makapagpamassage na. I mean, is it advisable for somebody who has sciatica?
For sciatica, we have to always remember, yung problema ng sciatica is yung ugat na iipit.
Yeah.
So, kahit anong massage gawin ng masahista ninyo, hindi maaabot yung ugat, no?
Yeah.
What it can do though, indirectly, it can address the muscles surrounding the spine. It can relieve the back pain. It can improve the blood flow, no, yung circulation sa muscles, para mas hindi pagod yung muscles, mas nagagawa niya yung trabaho niyang ibuhat yung spine, no. So that's the way, parang medyo indirect ang effect niya.
I see.
So I have patients kasi hindi naman laging sciatica lang nararamdaman eh.
Yeah.
Usually laging may back pain yan eh. Laging masakit din yung likod niya. So the massage aspect will help the back pain, maybe help a little bit of the sciatica because nga yung muscles niya nakaka-recover, but kung talagang directly na-address na yung problema, not so much.
I see. But on the other hand, can massage also be, parang, how do I say that? Can it aggravate kung ano man yung cause ng sciatica? Kasi di ba iba sabihin, pa-hard massage ko na lang.
Yun, okay.
Kasi o
kaya hilot.
Oo, hilot ko, ganyan. Pwede ba yung mas makapagpalala?
Minsan kasi, ako, when the patients ask kung pwede magpa-deep massage, Doc, yun ang hilig ko, yung talagang deep tissue and all that, I would say it usually causes more pain than anything else. Kasi, pag masakit na yung likod mo, mayroong inflammation. Namamaga yung muscle around the area. So, pag lalo mong manipulate, lalo mong dinidiin, you're causing more inflammation in the sense na lalong namamaga, lalong sumasakit. Magandang massage yung very light lang, very soothing lang, which improves blood flow para nakiklear out yung inflammatory mediators na mawala yung pamaga. That's good, no? We also actually recommend heat therapy, no? Or sometimes alternate heat and cold. Yung principle nun is you want to improve blood flow to the muscle para maganda na ng recovery, no?
I see.
So, that's why we always give warm compress or heating pad para mawala yung pain natin.
I see. Pero siguro mas ideal if, pag may mga kasambahi tayo na talagang may ganyang manifestation, nananakit, maganda magpakonsulta pa rin sa doktor. Kasi
That's
of course,
right, that's
you will
right.
be properly guided, and at the end of the day, it will still boil down to early diagnosis would mean early management and
That's right.
prevention of possible complications.
That's right.
And having said that, Doc, ano ba yung mga pwedeng complications ng sciatica if not managed early on?
Okay, so kasi like minsan you mentioned earlier, tama no, hindi naman necessarily slip disc yung problema which is causing the sciatica. There have been cases wherein minsan meron ka palang spine infection, no? Minsan pag may spine infection, hindi lagi naman nilalagnat yung pasyente. Sometimes hindi halata, no? Like for example, sa country natin, prevalent yung TB. And then we see a lot of cases na there's TB of the spine, na yung pasyente, dinadaing lang, sometimes back pain lang, hindi pinapansin for months, no? And then pag lumalabas na yung sciatica or lumalabas na yung weakness ng paa, pag diagnostic namin, kinakain na pala yung buto. It's important to correct, no, to see already a doctor once you have a sciatica that hasn't been getting any better. So that's a problem. Sometimes pwede hindi na infection, baka tumor pala, no, tumutubo sa spine, na iniipit na yung ugat. There are many possible causes, so it's really prudent to get a diagnostic right away, find out if it's just the routine slip disc or minsan namamagalang naman yung disc. If it's just inflammation, we have what we call an epidural steroid injection, na kabagalang, hindi naman ganun kalaki yung slip disc, nag-i-inject yung anesthesiologist sa likod para mag-shrink yung disc, and that is very effective. So,
I see.
it all depends on your first consult with the doctor, and once we get that initial diagnostic, we will be able to treat whether it's not so serious or a serious underlying cause. That is the reason behind your sciatica.
Yeah, and also I would like to add, no, napaka-importante rin na lahat ng information kung kailan nyo naramdaman. Di ba?
Yes, that's
I mean,
right.
kasi nagbe-base din ng mga doctor dun sa mga ipaparequest niya based dun sa mga sa history po na makukuha sa pasyente.
Yes, that's
okay, and talagang dyan kami mag-work on Di ba? Ang ating, tayong mga doktor, dyan tayo nag-work on sa sasabihin ng pasyente kung anong nararamdaman, what has triggered, okay, kung may attack of pain, ganyan. And eto, Doc, so basically, ito no, yung sa mga napag-usapan natin. So, I mean, with regards to preventive measures, so what can we share sa ating viewers?
So, for patients with sciatica, I would advise nga, no, lessen your sitting. We mentioned earlier, weight reduction as well. Lifestyle modification, definitely. So, another question I get asked a lot is parang may mga bawal bang pagkain, no, na dapat iwasan. Siguro you have to avoid foods that can stimulate more inflammation, no? Mga tipong highly complex carbohydrates, yan, smoking, alcohol. These are things that actually increase inflammation around the nerve, no? Which will actually sometimes increase the intensity of the sciatica. Daily exercise, daily stretching, yan, to prevent. And basically, that's just keeping your core very strong, very healthy. And then, pag may naramdaman, agad-agad pumunta sa doktor para magpa-check
Kasi
up.
iba talaga to try, hindi muna akong pain reliever.
That's
Tapos
right.
for long,
Oo.
nakita nila, overlook nila na, oh my God, ang tagal na pala nagpe-pain reliever. We have to understand, di ba, Doc, na ang pain is just a manifestation. It's senyales yan na may problema.
Exactly.
Hindi yan ang problema. Okay. And Doc, very well said lahat ng i-share nyo sa ating mga viewers. Thank you for that. And
Thank you for
baka you have some
having
final
me.
words po sa ating mga viewers, and you might also want to invite them to see you here at the Makati Medical Center.
So, again, if you have any spine problems, or kung yun ang nararamdaman ho ninyo, yung sciatica, yung pababa, yung may parang searing pain, pababa, mula puwet hanggang paa, or masakit ang likod nyo, na matagal na ho, hindi ho gumagaling, kailangan pa-check ho na ninyo. Iwasan ho yung laging nakaupo, no? Yung talaga yung nakakasama sa atin lahat, no? Keso sa bahay or sa opisina. Maintain proper posture all the time as much as you can, and then exercise na lang parati.
Okay, and baka may gusto kang batiin, Doc?
Wala naman. Sa baby ko na lang, si Emma, and my wife, Ceres. Hello.
Ayan, hello po sa inyo.
Yeah.
Okay, thank you once again, Dr. Buenaventura Canto, an orthopedic spine surgeon from Makati Medical Center. So kung we hope mga kasambahay, kayo po ay maraming natutunan sa ating episode. Think of this as your guide to embracing a healthy lifestyle. Prioritize your health over hectic agenda. Give yourself a proactive care because your health is absolutely worth it. And with that, may pag-uusapan pa po tayo mamaya. Huwag po kayong bibitiw. Magbabalik po ang Doctors on TV. Nagbabalik po ang Doctors on TV. Naku, at muli, narito po ang ilan sa mga karagdagang impormasyon ukol naman sa kalusugan ng mga bata. Maaari pong rare condition ito sa mga kabataan, pero mainam na tayo'y may alam. Dahil papaano kung ang ating mga anak ang makaranas ng herniated disc? Ano nga po ba ang mga dapat tandaan? Panoorin po natin ito.
Magandang araw mga kasangbahay. I'm Dr. Katrina Florcos Dacanay, your pediatrician for today. Kapag ang inyong anak ay madalas na sumasakit ang likod o kaya naman gumuguhit ang sakit papunta sa kanyang binti, pwedeng nakakaranas na siya ng disc herniation. Ang disc herniation ay kadalasang nangyayari sa mga matatanda, ngunit pwede ring magkaroon ito ang mga bata. Ano-ano nga ba ang dapat nating isaalang-alang kapag nagkakaroon ng disc herniation ng ating mga anak? Let's start our discussion now. Ang pediatric disc herniation ay tinatawag din na slip disc or ruptured disc. Ito ay nangyayari kung ang disc or yung cushion sa pagitan ng bawat buto sa gulugod or spine ay nai-injure. Ang gitna ng disc na ito kasi meron siyang jelly-like material na bumubukol sa pagitan ng bawat buto sa spine. Ito ay nagdudulot ng sakit at pagkirot. Ang disc herniation ay usually nangyayari sa mga buto ng spine na malapit sa balakang. Ang mga bata ay pwede ring maka-experience ng disc herniation, although mas common talaga ito sa mga adults. Some of the symptoms ng disc herniation ay pamamaga ng braso at binti, nanghihina yung mga muscles ng bata, kawalan ng nararamdaman, pagkirot na nawawala tuwing nagpapahinga ang bata, tumitindi ang kirot tuwing tumatayo naman siya ng matagal, yumuyuko, nagbubuhat ng mabigat o kaya nagtitwist siya ng kanyang katawan. Nawawala rin ng sakit tuwing naglalakad siya, tumatakbo o kaya nagpapalit ng posisyon. Maraming dahilan ang pediatric disc herniation. Ang una, nariyan yung congenital lumbosacral malformations. Ibig sabihin, present na itong problema na ito mula nung ipinanganak pa ang bata. Pwede ring pelvic structural abnormalities kung saan may problema na talaga sa shape ng balakang ng bata. Pwede ring cause ang injury tulad ng dahil sa hindi siya maayos na nagbuhat ng mga bagay kaya na-injury ang kanyang spine. Pwede rin cause ang vertebrae anomaly tulad ng scoliosis o kaya juvenile disc disorder na nakakaapekto sa lower part ng spine. Hindi lahat ng herniated disc ay kailangan ng gamutan dahil may mga cases na gumagaling ng kusa. Pero may mga cases na kailangan ng pain relievers, physiotherapy o kaya surgery. Ang treatment for herniated disc ay medications tulad ng pain relievers or muscle relaxants. So ito, nire-reseta po ito ng mga doktor. Kailangan din ng physical therapy para mabawasan ang sakit sa pamamagitan ng exercise o kaya ng stretching. Baka may mga cases din kayo ng disc herniation na kailangan ng surgery. Ito ay upang ma-correct ang mga abnormalities. And that's it mga kasangbahay. I hope marami kayong natutunan sa araw na ito. As always, please consult your pediatrician for your baby's health. Thank you again for watching today's episode. Again, I'm Dr. Katrina Florcos Dacanay. You can reach me through my Facebook page, Dr. Katrina Flor Cruz, YouTube channel, Dr. Katrina Flor Cruz, and Instagram or TikTok, katrinamd.ph. See you everyone in our next episode.
At sa pagpapatuloy pa ng ilang mga tips mga kasambahay, madalas ba kayong nakararanas ng body pain? Ano ba ang nagiging solusyon nyo pag kayo ay nakararanas nito? Itong aming ibabahagi ay ilan lamang sa mga pwede pong options ninyo mga kasambahay pag umaatake ang mga pananakit sa inyong katawan. Para po sa mga detalye, panoorin po natin ito.
Good morning mga kasangbahay, I am Mara, your movement specialist for today. Ngayong araw ay pag-uusapan natin ang tungkol sa sciatica at i-discuss ko sa inyo kung paano nakakatulong ang Pilates para ma-reduce ang pain ng mga pasyente na may sciatica. Importante na may regular exercise ang mga pasyente na may sciatica dahil nakakatulong ito sa pain management nila. May iba't ibang workout na makakatulong para kahit papano ay mabawasan ang pain ng isang taong may sciatica. Ang i-demo ko po ngayon ay piriformis stretching. Makakatulong po ito para mag-decompress ang lower back. Hihiga po tayo. Naka-de-quatro. Iangat ang kaliwang paa. Ipapasok ang kamay dito at hihilahin po towards your chest at naka-elbows out. Tapos kabilang side. Deep breaths here. Inhale. And exhale. Gagawin po natin yon for 5 repetitions on each side. Next exercise po natin, tawag ay bridge. Para po ito mag-stabilize ang abdominals para masuportahan ang lower back. So, hihiga po tayo ulit. Ang paa nasa bed or mat. Ang kamay po natin ay nasa sides. Tapos, ito-tuck po natin ang ating tailbone. Naka-engage po ang core. At itataas po natin ang pelvis. Tapos, engage lang po ng core, hindi po bibitaw ang core. And then, lower your spine slowly. Tapos, pagtatayo po, lagi pong nakatungkod ang kamay para hindi mag-compress ang back. Gagawin po natin ito for 10 to 12 reps. Next exercise is all fours. So, go on all fours. Stable core po. Diretso lang po ang likod. And then extend the left arm. And then extend the right leg. Hold the position. And then, down on all fours again. Do the other side. Inhale here. And exhale. We'll do the other side. Siguraduhin po na hindi naka-extend ang back. So, straight lang po yung likod. And then, gagawin po natin ito for 10 to 12 reps. Dahil sa health condition ng pasyente, kailangan na tamang exercise at posture ang gagawin dahil kung mali ang form ng pasyente, maaari itong magpalala ng kanilang kondisyon. Ano ang mga exercise na mas nagpapalala ng sciatica sa isang patient kaya dapat nating iwasan? Ilan sa mga nito ay flexion or extension ng likod. Ibig sabihin po, nagkakaroon ng compression anteriorly or posteriorly sa likod. Or yung mga exercise po na may rotation ng spine ay hindi rin po pwede. Hindi rin po pwede nagbubuhat ng mabibigat na weights kapag may sciatica. Sana ay nakatulong sa inyo ang mga impormasyon na ibinahagi namin sa inyo. And for more natural tips, stay tuned dahil natural is beautiful only here at Naturally Yours.
Ayan, mga kasambahay, na sana po ay makatulong sa inyo ang impormasyon ng ating tinalakay sa araw na ito. And with that, we conclude our today's enlightening episode. Naku, at lagi po naming dasal sa lahat ng may mga pinagdadaanan, lalo na sa kanilang mga kalusugan. May God bring healing and guidance to each one of you, mga kasambahay. Always remember, early detection saves lives. Make your health a priority. But before we end, take a moment to watch this.
Watch these snippets for the upcoming episode on Sunday.
So, the word meningitis, kasi yung gitis na part, it means inflammation. So, the meninges, yung inflamed, kasi yung meninges, ito nga, yung nagsusurround, no, parang protective layer na nagsusurround sa brain and the spinal cord. And yung area na yun yung nag-i-inflame for various reasons, no?
At yan po mga kasambahay ang aabangan natin sa susunod na linggo. As we conclude today's episode, we want to express our heartfelt gratitude to all our viewers for their steadfast support. Your continued dedication to our show has been the driving force behind our success and we are deeply grateful for it. We hope to continue earning your trust and loyalty. Thank you from the bottom of our hearts and I would like to greet ang ating Kuya Daniel Razon na walang sawang sumusuporta sa mga adhikaing serbisyo publiko. At syempre po, ang BMPI's General Manager, Mr. J. Eusebio. May God always protect you both and grant you a healthy life. And syempre, binabati ko rin po si Iyo, si Iya, yung aking kambal, si EJ, and si Doc Alain. At syempre, yung mga pasyente po natin sa Baka Sciatica Health and Wellness Center. And of course, nanay and tatay, I love and miss you both. At sa atin pong makasambahay, naku, maraming salamat po sa patuloy ninyong pagtangkilig sa Doctors on TV. And please like and follow my Facebook page. Just type on Facebook search box Dr. Sarah Baka Sciatica. We hope you found this discussion informative, empowering, and inspiring. Remember to follow us on social media for updates. Don't forget to tune in next time, God willing. Muli po, magandang umaga at maraming salamat sa inyong lahat. Ito po si Dr. Sarah Baka Sciatica. Let's make it a habit to learn about good health. Only here at Doctors on TV.
We would like to thank Makati Medical Center, a hospital with a heart. Located at Amarsal Street, Legazpi Village, Makati City. You may contact them at 632-8888-8999. Like and follow their Facebook page at I Am Makati Med, or you can visit their website at www.makatimed.net.ph. Makati Med Wellness Center, located at 7th floor, Ayala North Exchange Tower 1, Legazpi Village, Makati City. We would like to thank Adlaon Optical, located at ground floor Super 8 Warehouse Poblacion, Bariwag, Bulacan, 0922-878-5911, and second floor Aliw Complex, MacArthur Highway, Calvario, Meycauayan City, Bulacan, 0922-861-2095. Asian Breast Center is a premier healthcare facility dedicated to breast health and wellness. It specializes in breast cancer diagnostics, treatments, and disease management, offering state-of-the-art technologies in treatment guided by American standards and guidelines. Visit their Facebook page at facebook.com/Asian Breast Center PH. The Asian Breast Center is located at the 8th floor of Centuria Medical Makati, located in Kalayaan Avenue, corner Salamanca Street, Barangay Poblacion, Makati City. The center is open Monday to Friday from 9 a.m. to 4 p.m., except holidays. To get the best level of care, you can book an appointment by calling their mobile number at 0917-127-3278 or send inquiries through email ask.abc@asianbreastcenter.com. Breast cancer is curable and treatments are affordable when detected and diagnosed early. Lindison Gas Corporation, located at 179 National Road, Landayan, San Pedro, Laguna, 4023. For inquiries, you may contact them at 02-8824-0867 or 02-824-9360, or you can email them at lgsalesco@gmail.com. Clinica Figura, located at Entrata Building, Philinvest, Alabang. You may contact them at 0917-317-7272. Baka Sciatica Health and Wellness Center, located at Unit 1531, Centuria Medical Makati, Century City, Makati. You may contact them at 0917-317-7272 for appointments and other inquiries about your health and wellness needs. Dr. Sara Baka Sciatica would like to express her gratitude to Medical Depot, healthy num-num food. Where we go.